rings and receptionist picks up. Hello, this is doctor's office. Please hold.
You know what's one of the biggest time sucks in a clinic? Phone calls all day, nonstop. Patients calling to schedule, reschedule, ask about insurance, follow up on referrals. It's constant. And if you're short-staffed, the front desk can quickly feel like a never-ending rush. That's where Staffingly Inc. comes in. We handle patient scheduling, inbound calls, and even appointment reminders, all with a team of experienced, friendly virtual medical receptionists who are specially trained for healthcare. We're here for you 24/7, nights, weekends, you name it. But that's just the beginning. We also take care of insurance verifications, prior authorizations, and medical billing, so you can stop wasting time on paperwork and phone tag. Need someone to manage your EMR scheduling queue? We've got you covered. Overwhelmed by telemedicine setup or coding backlogs? Let us step in and handle it. And the best part? By outsourcing these tasks to us, you can save up to 70% on staffing costs while still providing top-notch service to your patients. I've seen practices transform with our help. Less stress for your team, fewer delays, and a smoother experience for everyone involved. Let Staffingly Inc. take care of the phone calls, scheduling, and all the admin chaos so you can focus on what really matters, taking care of your patients.
If you walk into almost any clinic today, you'll see the same thing. Phones ringing nonstop, patients waiting, insurance portals freezing, and staff trying to do 5 things at once. It's not because they don't care. It's because healthcare has become an administrative marathon. Prior authorization, eligibility checks, copays, messages, forms. Every minute spent on paperwork is a minute taken away from patient care. The truth is, this burnout isn't just happening to front desk teams. It's affecting physicians too. That's why more practices are turning to structured outsourcing and AI-driven automation, not to replace staff, but to help them breathe again, focus on patients, and actually enjoy medicine again. And that's what today's session is all about. Real physicians sharing real stories of how they have cut their admin workload by up to 70% while keeping care personal and efficient. Let's dive in. Hello, everyone. Welcome to today's webinar. Real doctors reveal how we slash 70% of practice cost without losing quality. I'm Sameeksha Gupta, and I'll be a moderator today. We have got an incredible lineup for you. This isn't any typical sales pitch. Today, you will be hearing directly from doctors who have lived it, tried it, and are here to share the story. Let me introduce our speakers. Excuse me. We are joined today by quite the dream team, a pediatric endocrinologist and a neurologist. One helps kids manage sugar, the other helps parents manage sanity. Together, they have seen it all and survived the prior auth process too. Dr. 𝗵𝗵𝗿𝗆, pediatric endocrinologist who has been using Staffingly prior authorization service for past year and a half, and she shared how outsourcing transformed her practice biggest headaches. Dr. 𝗫𝗵𝗿𝗆, neurologist who's using Staffingly's virtual medical assistants and AI voice bot. He'll walk us through how he went from chaos to control. Gokul, our prior auth lead at Staffingly, who supports Dr. 𝗶𝗹𝗆's clinic. He'll give us the behind the scenes on how they make it work. Kamal Darshik, team lead supporting Dr. Bhattacharya's VMA operations and documentation. He'll show us how dedicated team actually function day to day. And Dan Nandan, our CEO of Staffingly Inc., who will break down the myth, the cost, and the AI tools that are changing how clinic operates. Before we dive in, let's set the stage. Here's what a typical clinic day looks for front desk team.
The phone rings and receptionist picks up. Hello, this is doctor's office. Please hold.
You know what's one of the biggest time sucks in a clinic? Phone calls all day, nonstop. Patients calling to schedule, reschedule, ask about insurance, follow up on referrals. It's constant. And if you're short-staffed, the front desk can quickly feel like a never-ending rush. That's where Staffingly Inc. comes in. We handle patient scheduling, inbound calls, and even appointment reminders, all with a team of experienced, friendly virtual medical receptionists who are specially trained for healthcare. We're here for you 24/7, nights, weekends, you name it. But that's just the beginning. We also take care of insurance verifications, prior authorizations, and medical billing, so you can stop wasting time on paperwork and phone tag. Need someone to manage your EMR scheduling queue? We've got you covered. Overwhelmed by telemedicine setup or coding backlogs? Let us step in and handle it. And the best part? By outsourcing these tasks to us, you can save up to 70% on staffing costs while still providing top-notch service to your patients. I've seen practices transform with our help. Less stress for your team, fewer delays, and a smoother experience for everyone involved. Let Staffingly Inc. take care of the phone calls, scheduling, and all the admin chaos so you can focus on what really matters, taking care of your patients.
That's the reality so many of you recognize. Phones ringing off the hook, patients waiting, insurance companies pushing back, staff burning out. But here's the thing, it doesn't have to be this way. Let's see how that chaos can actually be controlled. I'm going to hand it over to Dan Nandan, CEO of Staffingly, to walk us through what outsourcing really means, the cost, and why clinics across the country are making this shift. Dan?
Hey, hello everyone. Thanks, Samiksha, for the introduction, and I wanted to thank Dr. Bhattacharya and Dr. Kalau for accepting our invite and joining this session. And rightly, you heard about what's happening at the clinics. I was last week. I walked into a clinic, and there's a front desk person. This is reality. She has a phone, probably chatting with someone, and there's a computer. There are three patients, screaming at the front desk, and then she's answering calls. Doctor's office, please hold. And they hang up. After 10 minutes, the patient calls back again, and this is a loop. And then after 6 rings, now the doctor takes the call, and he was certainly unhappy. So we are trying to fix this problem. Who we are, we've been in business for about 8 years, and we primarily provide healthcare staff outsourcing services with about 500 agents. We cover anything from what they typically call the virtual medical assistants, handling scheduling, phone calls, medical records, copays, no-shows. Handle those no-shows by sending those reminder calls, and then getting into insurance verifications, prior auths, revenue cycle management. And then the latest trend is the AI voice receptionist. I will cover that a little bit after we speak with our doctors. So let's stay tuned. Let me just jump into something here. I just explained we are a secured, we operate from secured facilities. We are HIPAA certified. We are SOC 2 Type 2 compliant. And thank God, in the last 8 years, with about 500 agents, we've never had a single infraction. Now, for newbies here who want to know what is outsourcing, outsourcing is just, think about hiring a remote employee. After COVID, we've always been hiring people remotely. And think about hiring someone remotely. So you're just, trying to outsource, take off that headache from your plate. In simple words, this is outsourcing. Now, a lot of my clients, when we get these calls, especially job seekers in the US, what is not on the outsourcing side? People think we are taking away jobs, American jobs. That's not the truth. Imagine you have a front desk person working 8 hours with all the breaks, and taking the load of 16 hours of work. As I just explained before, what happens in a clinic. Now, this is something at the fraction of the cost. We will take off anything, think of anything that can be done remotely. We will take over that workload. So the front desk, the providers, doctors, your nurse practitioners can focus more on patient care, not focus on admin workload. Now, so far, please stay in there. And then if you're liking what we are trying to explain you, take one moment, like this video, so others can get benefited from this session. Let's wait for 3 seconds. 1, 2, 3. Did you like it? Done? Well done. All right, Samiksha, over back to you.
Perfect. Thank you, Dan. All right, now for the part you all have been waiting for. Let's hear from the doctors who actually did this. Dr. Pulao, Dr. Bhattacharya, thank you so much for being here. And Gokul and Kamal, thank you for joining us. When we talk to doctors across the country, we hear the same frustration over and over. So let's dive into the real stuff. I have several questions for you, doctor. Dr. Pulao, this first question for you. I have to ask, before you started working with Staffingly's virtual assistant, as virtual agents, how much time were you and your team was spending on prior authorization every week?
I cannot even quantify the amount of time we were spending. I can tell you we were 4 months behind on prior authorizations, which is very difficult because I deal with a lot of specialty medications, growth hormone, diabetes, and obviously, particularly in the diabetes space, right? Like their life depends on them having the medications, right? And I was desperate. I was desperate because we were so behind on work, and we were finally able to find Staffingly. And to be quite honest, they're part of my team. They have made my life so much easier since we started working together. We meet weekly. I feel like I don't have the stress of the prior auths anymore in my office. I mean, it has been a game changer for my practice for sure.
Thank you so much for your kind words, Dr. Pulao. It means the world to us. I have a follow-up question for Gokul. Gokul, from your side, what's the turnaround time now compared to what Dr. Pulao was dealing with before you came in?
For insurance turnaround time, it is 24 hours if it's an urgent request, and it will take more than 3 days if it's a standard request. And the other turnaround time that we need to address is how soon are we going to work on those requests as soon as doctor prescribes the medication. I think just within a few hours, let's say a couple of hours, we start working on them. And if a provider starts mentioning something as urgent in the progressive, then we start working on it ASAP, right away, and we get the results for them. Yeah.
Amazing. Dr. Bhattacharya, this next question is for you. What was your breaking point? What made you finally say, okay, I need to try this? Dr. Bhattacharya, can you hear us?
I think there is a little speech break. Could you repeat the question, please?
Apologies. I'll just repeat the question. I just want to ask, what was your breaking point? What made you finally say, okay, I need to try this?
Well, we're a small practice. I am the solo provider. I think I have to probably echo some of the sentiment Pulao had. We had, at times, months of wait time for appointments. Normally, we had a backlog of hundreds and hundreds of referrals for months and months. And we also had the administrative task. And I think it took us only a few months, I have to say, credit to the team, that within 2-3 months, we are current with all. So that was my breaking point, just like any other. Things were not getting done. Patients were not heard. Referrals were scheduled. And that's where you guys came.
Thank you so much, sir. Kamal, since you have been working with Dr. Bhattacharya, how long did it take for you to really understand Dr. Bhattacharya's workflow and get up to speed with his patients?
Yeah, sure. Before going to that, firstly, thank you very much for having me here this morning. Dr. Bhattacharya, sir, and Dr. 𝗶𝗹, ma'am, pleasure talking to you this morning. And yes, coming to the question, that's a good question, actually. Honestly, when we first started working with Dr. Bhattacharya's practice, it took us about 3 to 4 weeks to really understand his workflow and patient flow patterns end to end. Initially, our biggest challenge was not just learning the tasks like call handling or the chart preparations, etc., everything that we are doing for him right now. I mean, every doctor, every clinic, every setting has its own rhythm. So the way they prefer confirmations, how they handle the emergency calls, and what details they look before scheduling the appointments is what we really focused on. So during the first few weeks, we spent time observing these patterns, like how his team prioritized the follow-up versus new patient charts, how he personally reviewed referral documentation. So we did all that. So once that clarity came, our turnaround time improved drastically. And earlier chart preparations used to take a lot of time, but now we do them in a very less amount of time. So for instance, during 1 week, Dr. Bhattacharya had a sudden spike in the amount of calls, and our team was able to handle all inbound and outbound communication smoothly because we already had the AI transcript system integrated and a clear escalation flow in place. And if you connect back to today's session theme, slashing 70% of practice costs without losing quality, that's exactly what happened. By taking the time truly to understand his workflow upfront, we cut down the redundant manual steps, reduced call volume errors, and saved his team's time. So in short, it took a few weeks of deep observation and collaboration, but once we understood his system, we became an invisible extension of his in-house team, providing the same level of focus at a fraction amount of cost. So that's what we do at Staffingly. Like in real world, if you are thinking to purchase a product, you look for its quality, you look for the best price at how much you're getting it. Not just that, the after-sales service. So suppose I purchased some product, it's absolutely perfect when I purchased it, but the after-sales is, sorry to use the word, disgusting, then how do you feel about it? Really bad. So the same goes here. What Staffingly really promises is we provide staff 24/7. Like, for example, if someone from your clinic calls out or takes leave suddenly, you cannot have replacement all of a sudden. You cannot have someone coming in and working for you all of a sudden. But here we have a huge team where we already have experienced persons working on the same tasks. So we can provide you an immediate replacement. So that's what we do. Not just cutting down your costs, not working at a cheap rates, but best price and best quality, what we do at Staffingly.
Very good. I think, White House needs a speaker like you. Let's move on with the next.
Perfect. Thank you so much, Kamal, but that was amazing.
Yes.
Dr. 𝗶𝗹, a very big question for you. Let's talk about money. What were you actually spending on prior auth staffing before, and what are you spending now? If you can give us some real numbers, that would be lovely.
Percentages,
Yeah.
not numbers, because this is,
Not
your
specific
I'm gonna
numbers.
be completely transparent with you guys. My office manager would be the perfect person to answer the question about cost. I can tell you that I did have like one full-time employee that was dealing mostly with the prior auth. And then unfortunately, because she was not enough, I had to take my MAs also to help with the process. So it would take at least 3 of my staff to try with this, help with this process. And I still was, like I said, 4 months behind on everything that I had to do. Then with staff, the team came in and we were able to be up to date. Now they are so actually have to write up my message. Please do the auth tomorrow when my note is done, because if not, they do it immediately. And then, I am even not done and they're already working on things. So I can tell you it's not only the cost. I know that it decreased significantly, because now instead of having like 3, I have 1 staff that deals with, 2 that deal with my prior auth. So definitely the cost decrease, but not only that, I feel like the patient satisfaction has been fantastic, because we are no longer getting angry calls to the office of why, the medication is not approved. So they help with the phone calls. They do things so quickly. Like, again, I said, just as they said, if I write a message that is urgent, within like 24 hours, I have a reply with the most of the time with the medication being authorized. So I think it's honestly not even about the money. It's about the quality of care that I want to provide to my patients. Like, my main purpose in life is to give the best care to my patients, right? Like, I do want to be able to do that, and I was not able to do that before. And now that I have Staffingly, I feel like things are working so much smoother in my office, and I couldn't be more grateful. And this is the one thing that if we have to slash on cost, this is not going to be the one. Like, this is the one thing that I keep telling other doctors about it, because honestly, it's a game changer for my practice.
Dr. Palau, I can't thank you enough. Your words are like so much with kindness, and we are absolutely grateful for it. And we are so happy that you are happy with our services. Dr. Bhattacharya, this question is for you. Thank you, ma'am. So let's talk about your in-house staff. How did they react when you told them you were bringing in virtual assistants? Were they worried about their jobs?
Well,
there's a lag,
I think we had a very smooth onboarding. There may have been some concern, but we worked closely with Staffingly folks and my staff. And actually, we made sure in college that these folks are their extension. These folks are here to help them. So day 1 or 2, it certainly wasn't there by the second week. We had a wonderful, and one of my main staff was going on medical leave. Very kind in getting this onboarding done. And I think we have been having an excellent relationship between my staff, and I believe every morning they have a quick little chat, what's coming on, and this has been pretty smooth. And I would say this really changed my practice in terms of reducing our stress from unhappy patients getting their authorization on time, not getting their phones answered, not getting their appointment, to answer phone calls. Every single phone call is getting answered. Every single concern is getting addressed. So yes, it is a huge difference in my practice. and like I said, our small onboarding was pretty good.
All right. Before you take over, Samiksha, we have a comment from a LinkedIn user, Lydia. Lydia, I don't know where you're watching this from, and thank you. You're definitely in the right place. Click the description below. You will see a discovery call link, or you can call us. Our agents are waiting. 800-489-5877. Once again, 800 toll free 489-5877, or you can visit our website, Staffingly with an L-Y, Larry, yellow, staffing with an L-Y, staffingly.com. Thank you.
Perfect. Dr. Palau, a question for you. I know
If
you
I may
have
step in with a
answered
quick little
this
story.
Please, 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 sir.
Please.
I'm sorry, can I interrupt?
Yes, please. Yes, sir. Absolutely.
I just wanted to share a quick little story about the AI.
Yes, sir.
And people has one incident that really reassured me working. I had a patient who was late, called the number, they ended up with the AI assistant. It actually found the road, gave the patient direction, brought the patient on time to my parking lot. They were only 2 minutes late, huffing and puffing, walked into my office.
So happy to hear this one, sir.
They were just like, my God, what is this?
All right.
What can we say, sir? Sorry, Dan, you were saying something.
That's pretty interesting. Wherever you guys are watching from, we're streaming live on YouTube, Facebook, LinkedIn, and Twitter, X. We will shortly, after we have a discussion with the doctors, we will be demonstrating the AI voice receptionist. So don't go anywhere. There are goodies upcoming. There are free trials and a lot of savings. Samiksha, over to you.
Perfect. Dr. Bhattacharya, technology at its best, sir. This is what we can say. Dr. Palau, I know you answered this question, but just if you, when you were first considering outsourcing services, you must have some concerns about quality. Like, what if they mess up? Will it reflect badly on your practice? If you can just like summarize it in one line, that after hiring us, how did it go? Like in one line for the viewers.
To be quite honest, yes, I was concerned, right? Because it's not something that I had done before. I had always had my staff work on things, but I knew that we were not doing it the right way. And it only took several meetings to realize that I was with the right company. They actually worked overtime to get us to be on time with everything. And my team, honestly, I don't even feel that they are far away. Like, I feel like my team is always available. They're a phone call away. They're always emailing me if things need to get done. So I meet with them every week. Like I said, it's great because I feel like I still have that hands-on that I need because I'm very detailed oriented. So, we already have a scheduled meeting every week, every Wednesday, actually at noon, we meet. So, the way that I was doing it, despite the fact that, again, I was using most of my staff to try to get things done, it was not getting done in an efficient manner. And I feel like having a dedicated staff that is not in my office has been, again, like a game changer to my practice, because we have been able to give good quality care in my office physically, but then outside of the office too. So I couldn't be more grateful in that sense.
Thank you so much, ma'am. Dr. Bhattacharya, this is a big one. Have any of your patients ever complained about talking to someone who's working remotely? What's the reaction been?
Well, honestly, when this is a new technology, new thing happens, people are a little bit concerned, but I think we have had actually very much of good positive interactions. And if there was ever a question, uh, it's my job to actually to explain and to allay the fear about whatever it is. It's not a problem for us. And the patients are seeing how they are getting their requests met. So even if there was a question or two or comments or two, quickly those are gone because people love seeing results.
Perfect. Thank you so much, sir. Just a question for my curiosity. Do you think we are quick learners?
Yes, you guys are very good quick learners. Just like you say, I was in a chaos. My office was in disarray, and I can tell you, within 2 to 3 months, I lived my office very happy at the end of the day, and the morale of my staff, in-house staff, has gone up. They feel much happier knowing the support they have, so they don't have to. You guys are great.
Perfect. Then I will say, woohoo, the mission accomplished. Dr. Pulao, this one is for you. If you could go back to when you first started, what's one thing you wish you'd have known, or what would you do differently? It's for the general public. If they are thinking about us, something you can share.
I wish I would have found you guys sooner. So I've been in private practice for 5 years now. I was actually working with a hospital institution who I had no say in terms of the staff, right? Like how things were handled. But I did start my private practice 5 years ago. And I think had I found you guys from day one, it would have made my life so much easier. I'm glad that I found you on year 3. It's been 2 years almost of us having a relationship, and there's no going back. So again, I feel like the workflow has been so different since we were Staffingly. And I think the most important thing for me is, to be quite honest, I always, like, I'm a small private practice. It's me, and I do have a nurse practitioner, but like part of, in terms of work, we are a work family, right? And my staff at Staffingly is still part of my work family. So despite the fact that they may be far away, I still feel them close to me. And, I honestly, I think the one thing that I would change is that I wish that I would have found them sooner. That's the one thing.
Perfect, man. And we are here to help any way you want.
All right.
And this is for the viewers.
Thank
We are in your backyard. We are based out of New Jersey, so it's not far. Dan, you were saying something.
Right. I see a comment from a user on YouTube, Bhaskar. My question to Dr. Pulao. Hey, Bhaskar, how you doing? I'm a clinic admin manager and wanted to know, how do you measure the return on investment, ROI, or actual savings from your outsourced healthcare services? The context is Staffingly. I think it's a question to you.
And that's a great question. I feel like I might not have an exact number to give you. I can tell you the fact that I can do all of it with 2 Staffingly staff versus, again, the amount of staff that required for me to have in-house is definitely a saving in the headcount payroll. Like, it's a noticeable saving. So I wish that I can give you an exact number. I'm not the type of person that loves to make things up. So I can tell you for a fact that just in payroll alone, it's definitely a saving.
Wow, there's a question for Dr. Bhattacharya as well. Dr. Bhattacharya, could you please answer, Were there any tasks you initially kept in-house, but later realized outsourcing teams can handle this better and cheaper? Wow, global point.
I mean, obviously, each of Staffingly is doing for me. I wanted to keep that all of that in house. I'm in the third decade of my practice in my own practice, having my in-house staff. Phone call to scheduling the patient, to the prior authorization, all of the things that you guys do. I find them Staffingly does it rather more efficiently, more effectively, and to the satisfaction of my patients. Again, I can't tell you the terms of how much cheaper. It certainly is a lot more. Would have been a lot more expensive if I were to hire more staff. And then, as you probably know, in fact, these days, getting a new and good staff is extremely difficult. I don't know about the other locations, but in the area in California, it is extremely difficult. And there has been times when we tried to hire somebody for months and months. The main goal is to find somebody who can help me, and staffing that at a very competitive. Again, the practice manager will be able to give you the exact numbers in a sense.
I think, as Dr. Bhattacharya was saying, I think the turnover of staff that we can have at the office and the amount of time it takes to train new staff is also so time consuming. And with Staffingly, I haven't had to do that, right? Like, I already have my people, and thank God I have been able to keep my people. But even I'm sure that if one of them is not able to make it, they find someone already who has been trained to take in that space. So I do not have to do the retraining. So I think, honestly, not only it saves money, but it does definitely save a whole bunch of time in having to train staff over and over again.
Okay, thank you, Dr. Bhattacharya. Thank you, Dr. Palau. Now, how cheaper? Please go ahead, sir.
I think Dan can answer that.
Right. So, if somebody wants to know how cheaper or how expensive can this get for the insurance companies, not for you. So, book a discovery call and we will answer those questions. I see a lot of comments pouring in. Doctors have limited time. We will still take those comments. And, I see a lot of comments about AI, federal, state regulations, and then I see security, encryption. We will certainly answer. Stay tuned, and we will run the session for some more time to answer every question, and then also do a demonstration on the AI voice bot. So, people have been asking questions about the AI voice bot. I think I would probably first run a demo on the AI voice receptionist while the doctors are here, and then we will continue the session.
The phone rings and receptionist picks up. Hello, this is doctor's office. Please hold.
You know what's one of the biggest time sucks in a clinic? Phone calls all day, nonstop. Patients calling to schedule, reschedule, ask about insurance, follow up on referrals. It's constant. And if you're short-staffed, the front desk can quickly
See Patients Clinic, your trust. calling Happy Patients Clinic, your trusted family doctor's office in New York City. How can I assist you? If this is a medical emergency, please hang up and dial 911.
All right. Good morning. Good afternoon. How you doing?
Good afternoon. I'm doing great. Thank you for asking. How about you? How can I assist you today?
I'm all right. I'm heartbroken. I don't know if I should see a doctor or a lawyer or maybe a counselor. Can you help?
Oh, I'm so sorry to hear you're feeling that way. Heartbreak can be really tough to navigate, and it's completely okay to feel unsure about what to do next. While I can't offer legal or counseling advice, I can help you schedule a visit with our doctor if you're feeling physically affected. Stress and emotions can sometimes take a toll on your health. If you think talking to a counselor might help, I definitely encourage that too. Sometimes just having someone to listen can make a world of difference. Let me know how you'd like to proceed. I'm here to help however I can.
But I don't have insurance. Can I still come in?
Absolutely, you can still come in. We welcome uninsured patients and can discuss payment options with you during your visit. Your health is important, and we'll do our best to make it manageable for you. Would you like me to help schedule an appointment?
Yeah, but if I schedule an appointment, will I be able to meet with you, have a cup of coffee? You have an amazing voice.
Oh, that's so kind of you to say. Thank you. I'm flattered, but I'm just a virtual assistant, so no coffee dates for me, unfortunately. However, I can definitely help you get set up with one of our amazing doctors who'll take great care of you. Shall we go ahead and book that appointment?
Sure. Do you have anything this week?
All right, let me check the schedule for you. Before we proceed, I'll need to gather a few details. Are you a new patient or an existing patient with us?
I'm a new patient.
Got it, welcome. Let's get you all set up. May I have your full name and date of birth, please?
My name is John Doe, and my date of birth is April 25, 1980.
Thank you, John. Could you please spell your full name for me, one letter at a time? I'll confirm it back to make sure I've got it right.
Sure. J-O-H-N-D-O-E.
Thanks. Just to confirm, that's J-O-H-N-D-O-E, correct?
That's correct.
Perfect, thank you. Now, just to confirm your date of birth one more time, that's April 25th, 1980, right?
That's correct.
Great, thanks for confirming. Lastly, could you please provide your email address so we can send you appointment details?
John@gmail.com.
Got it. Just to confirm, your email is john@gmail.com, correct?
That's right. So
perfect. Thank you.
Are we
now let's find you an.
Okay, sure. Go ahead. Sorry.
No worries at all. Let's find you an appointment this week. One moment while I check the schedule. All right, we have availability tomorrow, Thursday, October 16th, or Friday, October 17th. Do you have a preference for a specific day or time?
Yeah, tomorrow afternoon, anytime is fine. I just want to come down and meet with you. I'm still open for the coffee, by the way.
I appreciate the offer, John. You're making me wish I could step out of the virtual world for a coffee break, but I'll make sure you're taken care of by our wonderful team in person. So tomorrow afternoon works perfectly. How about 2 p.m.? Does that time work for you?
That works.
Great. You're all set for tomorrow, Thursday, October 16th at 2 p.m. with Dr. Elizabeth Monroe at Happy Patients Clinic. Our address is 1187 Grant Avenue, Suite 203, New York, New York 10027. If you have any questions or need to reschedule, just give us a call. We look forward to seeing you tomorrow. Anything else I can help you with?
That's about it. Thank you. Have a great day. All right, so you heard that. It's the bot is empathetic. By the way, if viewers out there, that was not a human. It's an AI voice receptionist, and using OpenAI ChatGPT in the backend, and they've improved a lot. So if you'd like to have one for your practice, see the description. Call that number 800-489-5877 or book a discovery call. Thank you. Yes, Dr. Palau, I think thanks for joining the session. I know you have to log off, see your patients. Wonderful having you here, and we'll definitely request you to come back on more sessions and time permits. Thank you.
Thank you. Bye, guys. Thank you so much for the opportunity, and I appreciate you guys so much, and I couldn't be happier. So I appreciate your time today. Thank you, and we'll definitely be back.
Thank you so much, ma'am. It was a pleasure having you here. Perfect. And
Thank you,
Bhattacharya is still here.
I think I take my leave as well.
Sure, doctor. Thank you. Thanks a lot for, I know you're traveling overseas and, you have taken the time. I know it's a little late in the night, and thanks a lot, and have a safe trip. Enjoy your vacation, and, we'll get in touch as soon as you're back in the country.
thank you so much, Dr. Bhattacharya.
Thank
it was
you.
a pleasure.
And bye-bye.
Thank you,
Good
sir.
luck to all of you.
Nice talking to you, sir.
Bye-bye. Take care. Thank you so
All
much.
right.
Thank you.
Yeah, Samiksha, let's get back into we have a lot of questions from the Zayed. If you can take those, let me just open up our presentation and then get into the first question here about the compliance. I would touch the compliance first because that's the more important point here. Selomit. Selomit is asking from YouTube, how should contracts be structured with outsourcing providers like Staffingly to ensure data protection, regulatory compliance, and accountability? That's a great question, Selomit. Now, the first thing here is, when you outsource your work to a company like Staffingly, you should definitely look at who they are. Are these just overseas firms? If there's an accountability, are these US-based firms? In our case, we are a New Jersey-based company, and with our locations overseas in Asia Pacific, countries like India, Pakistan, Bangladesh. But then we are a HIPAA ISO 27001 and SOC 2 Type 2 certified audited location. So we use encryption, we use virtual private networks, Amazon Web Services, HIPAA compliant, and the locations are fully secure. Staff members are not even allowed to bring their cell phones. So this is number one. And the second thing here is the liability insurance. Now, are these companies giving you a liability insurance if something should go wrong? What if you were sued by a patient, one of your customers? So we provide up to $5 million in liability insurance, just in case nothing happened over the past 8 years. But you never know. Just like the general liability insurance, umbrellas, they have workman's comp. When you run a business, you have employees. We certainly cover you. There's a limitation on how much is covered, but then it's all depending on the insurance company. But we keep that insurance levels pretty high, up to $5 million, and we will provide you with a certificate of insurance naming your business as additional insured. So that's how this whole process works. I hope I answered that question, but if you'd like to get into more details, click the link below. Book a discovery call with me and my partner. And I'm not another sales guy. I'm the business owner, so I'm not disappearing anywhere. So, or give us a call, 800-489-5877. I'll take the next comment here from our wonderful viewers. Once again, Lydia, thank you. you're watching on LinkedIn, wow, interesting program. And we will make it more interesting if you'd like to work with us. There is a 15-day trial and a 15-day invoice credit if someone has signed up before the end of this month. So you get 30 days free. No obligation, no setup fees, no long-term contract. It's pretty straight and simple, and you are paying a local company. You're not paying anyone overseas. Okay, now the next question from Alicia. Hi, Alicia. Okay, that's an interesting question, how we integrate AI into your process. We use a variety of tools. Everything is HIPAA compliant, and that's how it goes on and on, because it's a lot of technology that I need to talk about. But in simple words, we use HIPAA compliant machines to host, and everything is encrypted. And we use ChatGPT, Gemini, these models, large language models, in the back end for the AI operations, and we use a variety of other tools for automations, which are once again, they're HIPAA compliant. Now, let's get into some more questions here. Okay, this is interesting. Once again, about AI. Are there any federal or state-specific regulations? In reference to healthcare, David, thanks for the question. In reference to healthcare, the regulations are pretty straightforward. Once again, we have to circle. I just answered that. Once again, we have to circle around the HIPAA compliance. As long as your AI processes, your automations. For example, people have been doing automations on Zapier, N8N, Make.com. But then, they are openly hosted. If you are running your healthcare automations using Zapier or N8N, which is not installed on a HIPAA compliant server, every tool, every middleware has to be HIPAA compliant. So that is the federal regulations that still govern the AI, and we need to see what will change in the future. A lot of changes are happening now. It is getting more and more advanced. You just heard the voice bot. They're just getting amazing, and we can certainly have a meeting. If you click the link below, book an appointment with us, and we can speak in detail. Let me just go into the next question here. We have Aaron Blake Muhammad Barhan. Wow, this is really insightful. As a patient intake coordinator and admin, I truly feel I'm in the right place and excited to learn more. Thank you, Aaron. Thanks for that wonderful comment. Next one here from Samantha. I just answered this legal implications using AI for prior auths. I just answered that from another user. And you can still click the link below, book an appointment with us, or give us a call, 800-489-5877. Okay, John on YouTube. I'm a clinic admin. Okay, I think we have taken this with the doctors. Pretty much we have covered. Now let me jump back into where we got cut off. All right, so let me talk a little bit about Samiksha. Would you like to take over before I continue with the next process, with Gokul and other people?
I just have one thing just to add over here. You can see how outsourcing isn't just theory. It's working in real practices with real patient every single day. You heard from the doctors, and this is what we are doing here. Now, I will hand it over to Dan to walk us through the team behind this, the technology, and how you can actually get started. Dan,
all right. After my presentation, we would still want to talk to Gokul and Kamal about a few processes before we end the session. I know it's been an hour, but we'll try to quickly wind this up. Let me share my screen here. All right, so once again, welcome back. Would like to show a few items here and to circle around all those questions about data security, AI, what happens when you outsource. Now, on top of the HIPAA compliance, SOC2 Type 2, there is always a trust factor. Trust factor, number one, providers. These are amazing reviews posted by, you've just seen the real doctors who joined our session, who are our active customers. And on top of that, we have tons of these reviews on our Google page, Dr. Kazmi, Dr. Shrock, Dr. Mark, Dr. Gupta. So they've been posting a lot of great reviews. If they've had any problem with data security or they had any problem with the service, they would not be posting 5-star reviews. And wait, it doesn't stop there. Now, we're just talking about reviews from doctors, but then there were reviews. We keep getting a lot of reviews from patients as well. Patients, one of the patients actually posted on a clinic's website, very competent staff, including Sai. He's one of our other team members who was particularly helpful transferring records to my New York doctor. And there's another one. It was an email from a patient in Florida. I would like to thank Staffingly and Dan, all the staff that helped me with this pre-authorization nightmare I've been going through. You guys, he was getting some kind of control medication, narcotics, and we worked hard for a few days to ensure the prior auth was approved. Now, once again, to touch the services back, what we do, we provide virtual medical assistants who can handle patient calls, intake, scheduling, follow-ups, and then insurance verifications, prior auths, revenue cycle management, CPT, ICD, and fax data entries. That has been pretty popular because a lot of doctors have been moving from one EMR to another EMR, upgrade, downgrade, so we can pretty much handle that using automations, human quality assurance. And once again, people who asked about the commenters asking about the AI and automation services, we provide variety of services. To start with, we just had a demonstration of the AI voice receptionist, and then we can automate insurance verifications, prior auths, data entry and faxes, AI medical scribing. And if you ever call me, I can give you a $10 option per month, for the AI medical scribing. It can be as cheap as that can get, and get your charts updated on your EMR. Then you click OK to submit, update your charts on the EMR. Now, let's get into the cost factor. These are just numbers. These aren't really real, but then, there's always a 70 to 80% cost savings when you hire outsourced workers. Now, when I said cost savings, does it mean I'm losing quality? Not really. What we do here, we only 95% of our staff members hold advanced degrees. They're even medical doctors overseas. They're not licensed in the US, but then they do have a clinical background. You see one of our team members on the screen, Gokul. He's himself a doctorate in pharmacy, PharmD, and we only hire workers with healthcare background. It's a lot easier to work with providers because they know the language, they know the medications, they know the procedures, and that's a big game changer as opposed to many staffing firms. And like one of you asked, what should we look for? You should also look for, are we just looking for people who are like salespeople? We don't need salespeople, right? Somebody's interacting with a patient. You need clinically knowledgeable people, who have neutral accents, not thick accents, of course, and hire those type of people. Now, we support variety of practices. If you book a call with us, we can certainly tailor our services based on your practice. Every practice is unique, and we work with tons of different specialties and practices. And most important point here, we're not like a call center outsourcing company. We are an extended arm. You are hiring a staff member remotely who is supervised handled by us. You get daily and weekly reports, number of tasks we have done, and we do not rotate staff members. You hire John Doe or Jane Doe, that person is dedicated to you. You hire one, you hire 10. We always train backups. We ensure there's a team leader. We ensure there's a customer success manager. These are the investments we make into your practice. Let me just go back into my screen here. Okay. Now, so I'll try to wind this up. We work with variety of insurance carriers, governmental, Medicare, Medicaid, union, public, workers' comps, all commercials, all the flavors of BCBS, and sit on the phone for 45 minutes if required. I've seen many cases where Blue Cross Blue Shield, we need to really hold that phone for long, and we do that. And we also update the patient. So we worked on too many clearinghouses, EMRs, EHRs, and connect with us and see if we work on your EMR. And it's not hard to learn. There's a lot of AI now, and we can certainly work on those EMRs as well. So if you want to get the 30-day free trial, so it's a 15-day free trial, 15-day invoice credit. I want to be transparent here. 15-day free trial, 15-day invoice credit, and you get 30 days of free trial, risk-free, no obligation. We will still sign a business associate agreement, which covers the concepts of PHI, HIPAA compliance, and you can get the taste of our services. All right, Samiksha, back to you.
Perfect. Thank you so much. I know we are over time, but I will take last couple of minutes. Since we are talking about the entire process, our team leads are here, our trusted staff. Gokul, if you can just in few minutes, if you can tell us that what the entire process looks like. If someone is thinking about virtual assistants versus an employee in the office and how we work, if you can quickly walk us through the entire process, that would be amazing.
Okay. So let it be eligibility verification or let it be prior authorization. We don't expect any training sessions from the client unless they have some new EHR or they have any specific rules for their practice. We have all the trainers here readily available to train all the people here, and it will take just few hours or maybe one day for us to get trained on a new EHR system, whatever the provider is using. And moreover, before we start working for them, we'll establish a proper workflow and clearly define what we are going to do, how we are going to support, and everything well defined. And then we start we start providing the services. I think that is one of the key reasons we are very successful in this domain. We clearly define things and we go behind. And with all this in place, I think we have been able to very successfully run this for the past few years. It's all go to the credit goes to mostly the staff members who have constantly worked night shifts, and even then they have not compromised in the quality of the work, and they are very supportive for us. Together we are a great team, I would say.
Perfect. Thank you so much, Gokul. To all the viewers, this is what we do at Staffingly. We are just trying to be as helpful as we can for you. And if you're ready to stop drowning to admin work and start focusing on what you do the best, that is taking care of patients, book a call with us. Links are in the chat and on your screen. Please like and share as much as you can. Let's help everyone out there who needs help with healthcare industry. Thank you to all the speakers, Dr. Pallao, Dr. Bhattacharya, Gokul, Kamal, and Dan. Thank you everyone for joining us today. It was an absolute pleasure. We look forward to helping your practice work smarter and not harder. Have a great rest of your day. And thank you for joining the webinar today. Have a wonderful evening, everyone.
Thank you so much.
Thank you.